Welcome to the Ottawa Hospital. This video will explain what to expect when having a general anesthetic. The type of anesthetic will be decided on the day of surgery between you and your anesthesiologist. The word anesthesia means loss of sensation. An anesthetic can target different parts of the body and be given in different ways, including local, regional, and general anesthesia. Local anesthesia involves freezing nerve endings just under the skin to numb a small part of the body. You usually stay awake throughout the surgery. You may have had local anesthesia during an appointment with your dentist. Regional anesthetics include epidurals, spinals, and nerve blocks. Epidurals are used to prevent or treat pain after surgery. They are also commonly used for pregnant women during labor. Spinal anesthesia is used for surgeries below the belly button. Nerve blocks, or regional blocks, freeze a part of the arm or leg. With regional anesthetics, sometimes you stay awake during the surgery, and sometimes they are combined with a general anesthetic. General anesthesia is a state of controlled unconsciousness. The so-called sleep you get during a general anesthetic is different than regular sleep. A combination of medications injected into your veins and gases passed into the lungs is commonly used for general anesthesia to keep you asleep during surgery. General anesthesia can also be used with local or regional anesthesia to provide additional pain relief after surgery. Before your surgery, you will meet your anesthesiologist. They will answer any questions you may have. In the operating room, standard monitors such as a blood pressure cuff, heart rate, and oxygen monitors are used. An intravenous will be started, which will allow the anesthesiologist to give you medications to put you to sleep. While you are awake, an oxygen mask will be placed over your mouth and nose. You will be asked to take slow, deep breaths to fill your body with oxygen. Medications are then given through the IV, and you will start to fall asleep. After you are asleep, a tube is usually inserted into your mouth or into your windpipe to control your breathing. Throughout the entire surgery, an anesthesiologist stays with you to monitor you and ensure your safety. You may be given some medications to help you relax prior to the general anesthetic. The medications in your IV may sting, but this is not dangerous and usually goes away rather quickly. Falling asleep is often described as a feeling of lightheadedness. Once asleep, you will be given additional medications or gases to keep you asleep. General anesthesia is recommended or necessary for many surgeries. Examples include major surgeries of the chest, abdomen, pelvis, spine, or brain. A general anesthetic can be considered for any other surgery as well. Some patients see being asleep for surgery as a benefit of the general anesthetic compared to local or regional anesthesia. Discuss with your anesthesiologist which type of anesthetic is best for you based on your medical conditions and the planned surgery. The benefit of an anesthetic needs to be weighed against the risk of possible complications. This balance will vary from person to person, and your anesthesiologist will be happy to discuss this with you. Most healthy patients do not have problems with general anesthesia. The risk of complications following surgery is more closely related to the type of surgery that you are having and your overall health rather than to your anesthetic. Deaths due to anesthesia are very rare, roughly 1 in 100,000. People vary in how they interpret words and numbers. The following scale will help give you an idea of the risks involved with general anesthesia. For example, a risk is considered very common if it happens to 1 in 10 people, or for example, to someone in your family. On the other hand, a risk is considered very rare if it happens to 1 in 100,000 people, or for example, to someone in a city. Very common side effects include nausea and vomiting, memory loss around the time of surgery, and a sore throat. Common side effects include minor injuries to the mouth and confusion after surgery, which most commonly occurs in elderly patients. Uncommon complications include awareness during surgery, heart attack, stroke, damage to the teeth, or a lung infection. Rarely, a serious allergic reaction or an eye injury can occur. Death from general anesthesia is very rare. Awareness during general anesthesia, or waking up during your surgery, happens approximately to 1 to 2 in 1,000 patients. Most often, these patients have a vague awareness of their surroundings during surgery but do not feel pain. The rate of total awareness, including pain sensation, is thought to be much more rare. At the end of surgery, the medications or gases used for general anesthesia are stopped and the effects are reversed. Your breathing tube is removed and you will be taken to the recovery room. Although most patients wake up while still in the operating room, many do not remember events until sometime later when they are in the recovery room. Nurses in the recovery room will make sure that your pain is well controlled and provide medications for nausea and vomiting as needed. You may feel groggy or tired as you recover from the anesthetic, which usually only lasts the same day of the surgery. The stress of surgery may leave you very tired or exhausted. You may also have changes in your regular sleep pattern, slow bowels, as well as pain. All of these will improve over the next days, weeks, or months, depending on the type of surgery. Your surgeon will have instructions for your care after your surgery. Please feel free to watch this video again and to ask any questions you have during your appointment in the preoperative assessment unit. Thank you for watching.